Hi everyone, Jess and Al from the Psych Collective. Jessica, clinical psychologist.
Al Griscatus, psychiatrist. G'day.
And today we're going to do one of our first series on trauma, looking at specifically what is PTSD and what happens as to why some people actually get PTSD and why some people don't. So Al and I do a lot of work with PTSD in our normal day jobs. I do a lot of intense, long exposure kind of trauma work with them. You do a similar sort of paradigm. So this is something that we have been working with for a very long time. And what we wanted to present today was a rationale of what we see and how we work with trauma. So how we kind of view what contributes to getting PTSD.
Yeah. I think it's really helpful to have a kind of a model. If you've got PTSD, it's all this stuff just flooding over you all the time. So you want to kind of get an understanding of, well, why did these things happen and how does it all fit together? So that's the point of today.
Yeah.
So that's really nice.
So let's start. There's a traumatic event. Something happens. We know that bit. And then there is an acute phase. Now, the research shows that probably maybe 75 to 80% of people who experience a traumatic event don't actually go on to get full-blown PTSD. And we spent a lot of time talking about, well, why does that happen? Or why does that not happen, right? So following the trauma event, once you get out of the situation, there's an acute phase of, what was that? What just happened? What does this mean for me and am I safe? So this is all kind of the stuff that's churning around your head immediately after the trauma experience.
Yeah, no, that's assuming that you're not just being rolled into another traumatic situation. Okay, so unfortunately, what can happen sometimes is one trauma rolls into another.
Yeah.
So, but if you like, just for a more simple kind of version, that's where we're going to talk about today. That's exactly right. You survive the thing that just happened, and you're deeply impacted, and it's hard to make sense of what the hell's going on.
Yeah. Sometimes you're in so much shock that you don't realize how deep the impact is until afterwards.
Yeah.
So there seems to be some protective factors, some things that if they happen, or if there's space or time for them to allow to happen shortly after the trauma, then that seems to be something that prevents or protects people from getting PTSD. The biggest things that we see here is there's got to be a sense of safety. So get out of the situation and feel like you've got the space and then also the time to let things to start to settle. So this is something we see with first responders, military personnel, right? You've been to this traumatic car accident, really, really intense, get back to the station, still feeling really kind of aroused or agitated, or haven't had a chance to think about it. Phone call, next job, get back out there.
Yeah, absolutely. So that's I think that's why in both the military and in our first responders, that's why they accumulate so much trauma. They don't get a chance to actually do anything other than just get to the next job sometimes.
Yeah. So if there's space and time for safety, that's important. There's the other thing around the discharge of emotion. You want to talk more on that?
Yeah. Okay. So what happens if you see someone who's just been traumatized? They're a bit of an emotional wreck quite often. Okay. And what's going on there is essentially they've just survived whatever they've survived, and all this emotion is sort of pent up and it needs to get out somehow. So that might look like them wailing or crying or being hysterical or whatever.
The shaking.
Yeah. And that's fine. That needs to happen. Yeah. So you kind of don't want to say, just calm down, don't move, because they need to get that out. It's critical. Yeah. And often in the case of like a first responder or a military situation, they've just got to get on with it.
Yeah. And it's almost they get punished or penalised or viewed as weak if there is a discharge of emotion, because you're not supposed to have feelings. Shuttle that down, be professional, keep the stone face, don't show the public what's going on. So there are certain organisations or roles or environments that discourage this, which can contribute to that, but we'll get to that in a minute. The next part is there's got to be a connection, so seeking out contact with someone, ideally someone who's deemed as a safe person, which facilitates the safety, but then you kind of also gives you the opportunity to discharge the emotion when there's connection.
Yeah, that's right. Now, the discharge of emotion, that might look like anger, but it doesn't always look like tearfulness or whatever. It could look like, it'll look like whatever it needs to look like, okay? But it's probably not going to happen as successfully in isolation as it will with connection with someone.
Yeah, and then what we want is for the person to have an opportunity to sleep, because the cognitive processes that actually continue to happen while you're sleeping, during non-REM sleep and REM sleep, the brain starts to try and make sense of what that was. So really all of these things here is what helps us to make meaning. And from our point of view of what we've seen with our patients, those who are able to say, okay, this horrible thing happened, but I can see that it happened because of X, Y, and Z, they're possibly less likely to get stuck in the trauma experience. But the ones who get stuck is the, why did this happen? How could they do this to me? I should have done this or I should have done that, and kind of get entangled in this sense of, I don't understand why this happened. Why me? What now? And they're the ones who seem to kind of get into more of the chronic phase.
Yeah, and it's often the super stoic ones who'll just kind of tough it out,
grin and bear it.
But they accumulate these. So maybe you can have 10 of these and get away with it, but you get to 20 and you're in trouble. I just want to pick up one point that we missed there. Just coming back with the discharging the emotion. A critical reason to do that, other than the fact that you need to, is it's very hard to sleep unless you do.
True.
Okay?
Yes, and same with the safety. If you don't feel safe, you're not going to sleep.
Yeah. So discharging the emotion and getting into a safe situation. Ideally, this is facilitated with connection with someone that lets you sleep. Okay. Yeah. And the evidence is pretty clear. If you can't sleep after your trauma event, if there's no opportunity or it doesn't feel safe to or whatever, that increases your chances of tipping into chronic PTSD.
Yeah. Yeah, okay. So then we get to the chronic phase. And this is what we see as what are some of the kind of standout features of PTSD that kind of keeps it going. First of all, there's a fragmentation, right? So there's a fragmentation of the narrative, which usually looks like there's blank bits or there's missing gaps, or sometimes this bit, was it this way or was it this way? I can't really remember.
Yeah, okay? It's like we're not encoding the information in the way that you'd encode an ordinary day. It all comes in, the emotion comes in, the narrative of what happened comes in, any physical sensations come in. It all kind of makes sense. You get to the end of the day and there was nothing very remarkable, so you more or less delete that kind of day. It doesn't feel like it's alive still. Whereas these trauma events, they don't encode the same way. They're all fragmented. You remember this bit, you remember that bit, you don't remember that bit. Whenever you think of this, you're terrified. Whenever you think of that, you're mortified. Whatever the emotional state might be.
So there's a really, really intense emotional salience to the trauma, and it's almost like the trauma memories form their own little kind of network within kind of the broader scope of our brain, but they don't integrate. It's almost like there's a barrier that stops the trauma memories from fitting in with the other stuff. So it just kind of gets locked into its own little kind of bubble of trauma. Mm-hmm. That means that when one thing kind of activates that network, it goes ping, 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 ping all the way through the network, and then every other trauma memory can get activated. So when people feel like they're getting triggered, then everything can come up and their reaction can be bigger than what actually happened, but because in their mind, their entire trauma network might have just been activated.
Yeah, and when it's activated, it becomes kind of, that's really accessible to someone. Like it's just, they're caught in this. It's not like, think of some nice flowers and you'll be fine. Like people are really caught up and really kind of freaked out and intensely emotional.
Part of that is because the next part is there's this sense of temporal distortion, right? So most of the people who've experienced chronic trauma symptoms, it feels like it just happened. It might have been 20 minutes or 20 years ago, but it feels like it was only 20 minutes ago.
That's right.
So for some people, when they go into a full flashback, it feels like it's happening now, and that's the nature of flashbacks. But generally speaking, there's a sense of this feels recent, the emotion feels recent, the physiological arousal feels recent, my body feels like it's just happened.
Yeah, and when you ask people and you say, well, how recent was this? They'll tell you the time, but they'll say it feels like it was yesterday. You know, like it's just behind them, like just it's there. Almost on top of them. It has
still
that
able to kind of reach out and grab them.
Well, in the flashback,
Exactly. So then we see the exacerbated arousal, which is one, because it feels like it just happened, but two, there is usually still this sense of, because it just happened, it could just happen again. And so that kind of, I don't feel safe, I don't believe I'm safe, this drives up the hypervigilance sort of behaviors, the distortions around, I can't trust people, nowhere's safe, you shouldn't go to these places, right? Which ultimately feeds into avoidance. So it's avoidance of...
Yeah, if you're going to get freaked out, and this is as uncomfortable as it gets.
Oh yeah.
Okay, this is like being re-traumatized practically. So people kind of learn, all right, if I don't go to this sort of situation, if I avoid crowds, if I avoid, seeing people in uniform or whatever it might be, I'm less likely to get triggered. So I'm going to do more avoidance and have less triggers.
Yes.
But the problem is you shrink your world.
You do. And then because you don't want to think about it, because you don't want to feel it, because it's messy, you stop looking for the meaning.
Yeah.
So you stop trying to explore this. So you've got this acute phase of what was that? And then you get here where you go, I don't want to think about it. I don't want to deal with it. I don't want to talk about it. I don't want to feel it. Just let me hide away from the world and leave me alone.
Yeah. With a lot of avoidance, though, I mean, the other thing is it's going to bubble up.
Yes.
on its own accord.
Absolutely.
Okay, it's we talked about that analogy the other day, the earworm analogy.
Yes.
Okay, so an earworm is that situation you have where you've got a song stuck in your head. Okay, and it might be playing and it's sort of really annoying, and it might go on for hours.
It's usually only a fragment of the song.
Yeah, well, that's the thing. That's the thing. So the solution to curing an earworm is to actually find the song and play it in its entirety, and that cures the earworm. And it's a little bit like that with this. Okay, but the problem is you can't listen to the song, or in this case, experience the trauma in its entirety, because it's all fragmented.
And it's scary as hell because it feels like it's just happened.
Yeah.
So there's this really kind of messy situation of, I don't want to think about it, I don't want to feel it, because every time I try and tap into that, it feels so intense that it's overwhelming. And shut it back down again. Yeah.
So we end up in the unfortunate situation where we're avoiding thinking about it. We're not looking for the meaning of it. We're not looking for the lesson of it. We're just stuck with avoidance. Our world is shrinking, and we're having lots of terrible symptoms.
Yeah. So then we get here where we're looking at, okay, what are the actual symptom clusters of PTSD, right? So this kind of taps into some of the stuff around DSM criteria. We've expanded it slightly. So you get, again, where it feels like it's happening again. So this is the intrusive experiences of an image or part of the memory pops up. The flashback, where it's almost like you've got your VR goggles back on and you're back in it and it's happening now. Or the nightmares, which is effectively the same thing, just nocturnal. Okay, the anhedonia, so this means loss of interest or pleasure in activities previously found enjoyable. It just means nothing's fun anymore. There's lots of negative emotions, and it's very difficult to tap into or experience any positive emotions. Attitudes and assumptions looks at the way that you think about yourself, other people. It looks a lot at horror and anger and blame, and who are you pointing the finger at? What are your beliefs? How have they changed about the world? Particular groups of people, particular religious beliefs, or stuff around kind of these people made it happen, or these are bad people, or I'm a bad person. Then we get to the arousal, which is again kind of that heightened, it's the startle reflex, the hypervigilance. Sometimes this can be recklessness or impulsivity. There's sleep disturbance in here. There's also difficulty with concentration, mostly because the system's just hyper aroused.
Yeah, and there's often, I've got to do something to dampen down my arousal. How about I drink a bottle of vodka or whatever else?
Sure.
So you get complications off that as well.
In a subset of people with PTSD, we get these symptoms of extreme dissociation, technically called depersonalization and derealization, where either it's like an out-of-body experience or there's a detachment from reality. So like you're kind of third person, kind of, you got bird's eye view watching yourself in this. It happens, but not for everyone. So this is kind of a subset of the feeling, and it's usually triggered by a heightened state of arousal, which still feeds into avoidance. So it's avoidance of people, places, crowds usually, but also sensations, emotions, the thoughts, the memories, the feelings of it. News and media, things that could be potentially triggering, because if we get triggered, then this happens again and the cycle just continues.
Yep. So then what do we do?
Well, what do we do? Well, really it comes down to, we've got to make sense of it. The only way you're actually going to be able to resolve the trauma is to get to a point where you can find a way to integrate the trauma. So we're going to go through this more in our next video, right? So this is one of a 3-part series, but quickly speaking, what it's going to come down to is you need to make sense of the trauma or the meaning of the trauma, all right? You need to be able to tell the story. You've got to get the whole story out, because we've got to kind of fix that fragmentation. Telling the story over and over helps to fill in some of the gaps. And we need to reduce the arousal in the body and kind of prevent the avoidance. So there needs to be an integration of the brain and body. All right, so we're going to go through those in more detail with our next talk on the life cycle of PTSD treatment, and then we're going to follow that up with another one where we talk about the different categories of trauma and how they need to be understood in order to be able to facilitate meaning. So that's it for now. Stay tuned for our next video. If you want more information on this, sitecollective.com, Facebook, Instagram, hit the subscribe button on YouTube, and we'll see you shortly. Thanks guys, see ya.